Thank you so much, Lucian, for the introduction, and thank you all for coming in today. So I'm going to start by talking a little bit about dystrophin and the brain. So just a tiny bit of background before we go into the study. So muscular dystrophies are most commonly perceived as genetic disorders that affect mainly the muscles. However, through current research, it has been shown that other parts of the body can also be affected, with a major one being the brain. To further understand this relationship between the dystrophin protein, commonly missing or not even produced properly in Duchenne and Becker's, and the brain, research has been conducted with various animals and more specifically with mouse models. So the results for such studies showed that mice in Duchenne had difficulty adapting to new situations. They had difficulty remembering simple information to make decisions and were found to be overall in a state of excitement or hyperarousal. Similarly, brain imaging studies in humans have shown that missing dystrophin in the brain can actually impact the structure and its function as well. What does this all mean, though, for individuals with Duchenne and Becker's? Do they all have the same behavior or same difficulties? We need to highlight the fact that the average individual with Duchenne and Becker's does not exist. Each and every one of them are unique with their own strengths and difficulties. What is important is to ensure good quality of life for them, as difficulties not associated with motor abilities have started to play an increasingly important role since life expectancy is prolonged, something that was not previously expected. We are therefore interested in uncovering some similar patterns that will help us to identify potential difficulties early on, address them, and provide the appropriate support. Currently, we're aware of cognitive involvement and neuropsychiatric manifestations associated with Duchenne. So starting with the cognitive involvement, studies have shown that there is an impact on learning as measured by the IQ that can translate sometimes in intellectual disability. There is also a greater risk of language delay. As you can see here, there is a 60 to 70% prevalence. Also, there has been shown to be some executive function problems that basically include difficulty in describing and explaining things. There's a difficulty finding the right word, sometimes difficulty relating sequences of events, difficulty organizing thoughts and expressing them clearly, as well as going from one task to the other. Neuropsychiatrically now, meaning how the behavior and the emotional well-being is affected, only very few studies have focused on these aspects, and mainly they have been done through parent and self-questionnaires, as well as some observations. These few studies have shown an increasing risk for attention problems and perhaps some hyperactivity, some social communication problems, and a lot of emotional and behavioral difficulties. And those include angry outbursts, some meltdowns, perhaps finding it difficult to be flexible. There's also some obsessive or unusual interest in specific topics, and there is an increase in anxiety, which has been underrecorded due to the fact that it's mainly presented as anger, low tolerance of stressful events, perhaps being shy, withdrawn, or avoiding eye contact. We're not still sure why this is occurring in some individuals and not in others. And we know even less about individuals with Becker's, as there hasn't been many studies on this population. So a lot of studies have focused on general intelligence, as you can imagine, and not other specific areas such as the behavior problems that we mentioned. And therefore that might lead to an underestimation of the potential difficulties. So further research is definitely needed. Now, currently, there are a number of state-of-the-art assessment tools available to measure behavior. However, before we start applying those with the risk of causing fatigue for individuals, we need to first identify the areas that they are most important and most appropriate for us to focus on. Taking all of this into consideration, all the previous findings from research, Jos Hendriksen, a neuropsychologist from the Netherlands with years of experience working with Duchenne individuals, proposed the Big 10 of Duchenne. So this is a model that has 4 main domains covering cognition, learning, emotion, and neuropsychiatry. Within those domains, we have 10 problem areas as illustrated in the diagram below. So, for example, the cognition domain includes automation, working memory, and attention difficulties. In the learning section, we have dyslexia and dyscalculia, which means difficulty with reading or having difficulty with numbers. In the emotion domain, we have difficulties with anxiety and depression. And in the neuropsychiatry, we have ADHD, autism, OCD, which is some of the few of them that occur. As you can see, a lot of these areas can overlap and occur at the same time, making the picture a little bit more complicated and difficult for professionals to assess properly. And this is where we come in with the BIND study. As you can see, we're a big team of professionals from different backgrounds with the goal of developing ways that we can enhance and support the lives of individuals with Duchenne and Becker's. And now I will pass you on to my colleague Isabella, who will give you some more details of what exactly we do with this study.
Hello, thank you, Andrea, for this introduction, nicely leading to the aim of the BIND study, which is actually to define the behavioral and emotional profiles of individuals with Duchenne and Becker muscular dystrophy. BIND is a big European consortium, and we have 6 participating countries: Denmark, France, Italy, Spain, the Netherlands, and the UK. In particular, in the UK, we have 2 sites, London and Newcastle. In London, we are aiming to recruit boys from 5 to 17 years old with a diagnosis of Duchenne muscular dystrophy. Whereas in the Newcastle, they're aiming to recruit boys from 5 to 17 with a diagnosis of Duchenne, but also males from 5 to 50 with a diagnosis of Becker muscular dystrophy. Due to the COVID pandemic, the study needed to be adapted, so we have an online part, which is the part 1, when we will ask participants to do questionnaires to assess the behavioral profile of Duchenne and Becker muscular dystrophy. And in this part, we actually aim to recruit 800 participants across all sites and 190 in the UK. Part 2 will be a face-to-face assessment conducted in clinic, and we will do standardized cognitive assessments assessing the domains that actually, some of the domains that actually Andria showed before. And we will aiming to recruit participants who have completed part 1. However, if you haven't completed part 1 and you are happy to be involved in part 2, we will also give you the opportunity of completing part 2 part 1 while we do the face-to-face assessments. There's an optional MRI that will be done with a subgroup of participants. And overall, we're aiming to recruit 300 participants across all sites, with 77 in the UK. This is the team in the UK. So in London, it will be me and Andria that will be involved in testing and recruitment. And in Newcastle, there will be Monica involved in recruitment and Catherine involved in testing. Now I will discuss about the part 1, so the online part, and I will show you how to join and what happens after you join. So this is just where we are at with the recruitment. So in London and Newcastle, we are aiming to recruit 95 participants for each site. In London, we started in November and we have recruited 40 participants out of 95. And Newcastle just recently started and they have recruited 3 out of 95. So what will happen is that if you express an interest, we will send you the information about the study and we will ask you to complete the consent. Once you have consented, we will send the online questionnaire that will take approximately 1 hour. And you can see in red here our contact details. So the first step will be to contact us. So you can contact, again, Andria and me if you're joining for the UCL side, or Monica if you're joining for the Newcastle side. After you have contacted us, if you're joining for UCL, we will send you an email with a link that will direct you to more information about the study and a consent online. If you're joining from Newcastle, you will be able to consent through the phone. After you have consented, we will send you an email with the ID and password that will be needed to log in to the questionnaires. And we will also include the links to the actual questionnaires. So as mentioned, there are 2 questionnaires. This is the first one. So once you click on the first link, you will see a page like this one that will ask you to choose a language among one of the bind languages. Then you will be able to put your participant ID, which country you were recruited from, and if you're completed this as a parent or as a young person with Duchenne. As it's important to mention that if your child is over 16, we will ask your child to self-report. If your child is under 16, we will ask you to complete the questionnaires. So we will ask the parental perspective. So we will have a parent report. After that, you will be able to input the password. And this is how it will look like once you start the questionnaire. After you have completed the first questionnaire, you can go back to the email with the link for the other questionnaire that it's called DOBA, and you will direct it to a new page like this one. And if you click on the 3 arrows there, you will be able to you will be directed to a new page, and you will be able to input your ID number and your password. And once you're in, you can start completing the questionnaire. You don't have to complete all at the same time. You can complete them in multiple settings. And in this case, you just need to click "I finished at least for the moment" and come back when you can to complete it. Important to mention here that if your son is over 16, we will ask also your son to complete. So we will have the parent report, but also the self-report for your son. And we will send them a separate ID and password to link. And now I will leave the word to Andria that will discuss about the part 2.
Thank you very much, Isabella. So basically just a quick run through of where we are right now with the study. So part 2 only started very recently for both of our sites. So in London, we're aiming to have 40 participants, as Isabella mentioned. And in the London side, we have 2 out of 40. And in Newcastle, they're looking to recruit 37. They started very, very recently. So currently they are creating a sort of waiting list for people to be contacted to start very, very soon. Here we go. So what will happen once you join the study? So if you express an interest, we're going to send you the study information to read through, and we're going to allow you some time to think about joining our study. Then once you have mentioned to us that you will be happy to be a part of it, we're going to invite you for a face-to-face clinic appointment. During that time, you can complete the consent form with us, and then your son can complete the cognitive tests. As you can see, this can take a little bit long, so it can be between 3 to 4 hours. However, this does not need to be completed in one go. So we can have multiple sessions, and the way that we organize it is for GOSH patients, we're going to try and make sure that you are going to have an appointment maybe on your next clinical visit to just make it easier for you. If you're not a GOSH patient, then we're just going to be giving you some weekdays. However, we're very flexible, and we can also offer weekends, and we can also offer holiday dates. At the same time, as Isabella mentioned earlier, if you're interested in taking part in part 1 as well, while your son is completing the cognitive tests, you're also going to be able to complete the online questionnaires with one of the team members, while the other one is doing the assessments with your son. So we just wanted to give you a little bit of an overview of how it's going to look like on the day. So this is me with one of our amazing participants. As you can see, the setting is very simple. We're going to be inside a clinic room. We're going to have a table with lots of different things on it. So you can see a couple of puzzles that we play. We have a couple of questionnaires to fill. There's going to be a little bit of vocabulary testing. We're going to have some memory and arithmetics. So it's all really fun. However, because we are aware that it can be quite burdensome, we're going to allow plenty of breaks in between just to get some rest. And as I mentioned earlier, we definitely do not have to go through the whole assessment in one go. It can be separated in different visits. Now, if you're interested, we also have an additional part, which is completely optional, and that includes an MRI scanning. So what we are going to ask you to do for this, if you and your son are interested in taking part, is to complete a safety questionnaire just for us to make 100% sure that we are following all the safety measures and it's completely fine for you to come into the MRI. And then we're going to invite you to come in for the scan with your son. The scanning session is going to be 60 minutes, so about an hour. And the reason why we allocate this is because we want to take a few things into account. The scans themselves, they're going to be approximately 30 minutes long. However, we allocate a bigger slot because we want to make sure that we allow enough time for us to go through all the details with you and your son. You have time to ask us any questions if you would like to, or any clarifications. And then we want to make sure that we place your son safely and comfortably inside the MRI machine. The scan, as I mentioned, is only going to take 30 minutes. And we are also able to allow for breaks in between if it becomes too uncomfortable or there needs to be a toilet break or anything like that. So that's why we have the extra time for us to be able to be as relaxed as possible. Now, a very important part is that at the end of BIND, both part 1 and part 2, we are going to provide you with a feedback report. And this is going to happen at 6 months after completion of the study. From previous studies that we have done, participants have mentioned to us that this has been very, very useful for them. And the ways that it has been used in the past by them is, first of all, it gives very good insights in terms of potential difficulties of your son that you might not be aware of. It can also be used for any additional educational support that you might like to seek from the school. And finally, it can also be used for a further referral to your local authorities to get some further support if you need to with some behavioral difficulties that might have arisen. It's very important, though, to highlight that this is not a clinical diagnosis. This feedback is given under research setting. So the only way that it can be used is just to inform and help you to seek out for further support. We are also including some organizations that you might already be a part of, or perhaps you're not aware of, and you can go and find further information about Duchenne and the support that you can get. And at the end, we're also going to have all the links and the details, contact details, in case you would like to get some more support from us, or there's some issues that have arisen from the feedback report that you would like to further discuss. So that was all from us. Thank you so much for joining us today, and we will be happy to answer any questions that you might have.
Thank you very much, Andrea and Dr. Isabella, for this very clear presentation. I do see we have some questions as well from the audience, and as well send in advance. Audience as well, if you have any questions, just put them in the chat and the Q&A, and we'd be happy to discuss. But one of the questions that we actually received was around the dates and the timeline. So what is approximately the length from the point that you say, I will join the study, and how many visits will there be? We talked a little bit about the length of the questionnaires, but how will these visits exactly consume in terms of time?
Yeah, so the questionnaire, we said it will last approximately 1 hour, but it can be done in multiple settings. So they don't have to complete them all at once. And after they complete the questionnaires, we will, if they have consented to part 2, we will send them an email or call them to arrange a visit. And the visit can be arranged whenever it's most suitable for the families. So it can be done, if they're Gauche patients, it can be done during the visits, the clinic visits, if that is a possibility. Otherwise, it can be done any day of the week, and we're also able to do them during weekends. And the assessment will last approximately 3 hours.
All right, thank you very much. Now, another question that we received is about the reimbursement. So will there be a reimbursement of the travel expenses?
Yes, of course, and that is a very important question. So in terms of reimbursement, we are going to cover for travel expenses, and that would cover one child and one parent. And we also, for parents who live quite further away, families who live quite further away, we are also going to offer an accommodation, an overnight stay, if that will make things a little bit more easy. And again, that will be for one parent and one child.
Wonderful, thank you so much. Now, another question we received from the audience is, are there any exclusions for additional risk factors, for example, any psychiatric disorders in parents?
No, we don't exclude psychiatric disorders, family history of psychiatric disorder. We actually asked that in one of the questionnaires because it's of interest for us. And the only thing that we might decide if we want to exclude if it is a very stressful time for the young person itself at that moment. So we would ask perhaps to wait a couple of months. I don't know if Andria, you want to add anything to this?
The only thing I would like to add is we do exclude for any severe comorbidities that might impact their performance, and also perhaps if there is a surgical intervention within the next 6 months of taking part in the study.
That's a very clear answer. Thanks very much. Now, I have another question from the audience, and that is actually one that we often receive, also not just related to the UK families, and that is, does my child need to have a learning difficulty in order to join this study?
So not really, because what we're trying to do is create a profile for us to understand in general Duchenne and Becker's individuals. So really what we would like to do is have as broad spectrum of a sample as possible for us to make it clear how much is it presented in the population and how much is not. So if we just were to pick the ones that they would have behavioral or learning difficulties, we will make our result very, very skewed. And we just would prefer to have like a clear image of what is happening in the population. So you're welcome to join if you have behavioral or learning difficulties, or if you don't have.
Wonderful, thanks very much. Now I'm just scanning through the Q&A to see if we have any other pending questions.
I just wanted to add something about the part 2, the face-to-face assessments, that we will of course provide breaks for the families, and if there's no possibility to complete that in a single visit, we can do multiple visits as well. So we're very flexible.
I'm glad to hear that. And what about this online questionnaire? Because that one was taking approximately 1 hour as well.
Yeah, that can be done in multiple settings as well. So they can stop at any time as long as they keep the login details. But if there are any problems, we will be able to help.
I'd like to thank Andria and Isabella for presenting this UK webinar. I put in the chat the contact details for both the UCL site and the Newcastle site. If you have any questions, you can ask them, or you can just take a look on the BIND website, because this one also contains information about the study and how to join and some additional information. And with that, I'd like to end this webinar. I would like to thank you all, and please note that this webinar will be published on the website together with a small summary. So if you want to rewatch it, feel free to head over to bindproject.eu for every kind of information. Thank you very much, and wishing you all a very nice evening.
Thank you very much. Thank you all.
Thank you.